Welcome to the Modern Day Naturopath Podcast with Dr. Sue. Real talk for those craving deep healing whilst living in a modern day society. You'll be equipped with knowledge to make profound mind-body shifts that utilize ancient wisdom and will facilitate your healing once and for all. Inspired by Dr. Sue's chronic illness journey and all the real and raw pearls she has learned along the way. Come as you are. It's never too late to start.
Welcome back to the Modern Day Naturopath Podcast. This is Dr. Sue. Today we're going to dive into Epstein-Barr Virus, also known as EBV, and what can actually be the root cause behind your persistent fatigue. I'm so excited today to have Dr. Kasey Holland here with me to shed light on this super important topic. Dr. Holland is passionate about empowering people in their health. She helps patients navigate complex health concerns and restore health and vitality. As a licensed naturopathic doctor, she believes that health is made up of mind, body, and spirit. Through her clinical experience, she has seen environmental toxins, infections, chronic inflammation, and stress disrupt these pillars of health. She uses a complete holistic approach to tackle health concerns, no matter how simple or complex they may be. Dr. Holland has spoke internationally on targeting Epstein-Barr virus with antioxidants. She is certified in mold illness healing through Dr. Jill Krista and is the Montana House of Delegates representative for the American Association of Naturopathic Physicians. Thank you so much, Doc, for being here. Welcome.
Thank you for having me.
So excited to talk to you about this today because, as you know, it's a huge buzz everywhere about Epstein-Barr, and people are very confused about it. They're not really sure which avenue to go. So before we get started, love you guys to press pause and go follow Dr. Kasey Holland. It is DrKasey Holland, HOLLAND on Instagram. And my Instagram is dr.susanc. You can find more information about Epstein-Barr. Dr. Kasey has amazing reels, information that you can dive in and learn more about Epstein-Barr. But before we go into what Epstein-Barr is and how you treat it and root causes, I'd love to know more about yourself, how you got into naturopathic medicine, and what made you get into more of chronic illnesses, chronic viral type infections. What led you here?
Yeah. Well, it actually started when I was very young. I had some chronic gastrointestinal symptoms that resulted, I had really bad anxiety actually when I was about 10 years old. And conventional doctors wanted to do exploratory surgery on my stomach. They wanted to put me on psych meds. Thankfully, my mother was, so I always tell people that naturopathic medicine found me, that I didn't choose it, that I had no choice. But my mother, she was told she'd never be able to have children, and she went to a naturopathic doctor and got pregnant with me 3 months later. So she knew, yeah, it was so super
I love
cool.
that story.
Yeah, she saw a really amazing doctor, Dr. Weiss, Ralph Weiss in Oregon. He's no longer with us, but he was one of our elders. And so, she took me to a naturopathic doctor and I got so much better. And I think it was about when I was 14, 15 years old. I just said that, that's what I was doing with my life. And I shadowed the naturopathic doctor that helped me through high school and then went straight on to our path. So it's just kind of always been a part of my life. The chronic illness realm, I was always interested in that because when I was in medical school at Bastyr in Seattle, I was struggling really bad with fatigue and really struggling to keep up with school. And everybody just said, oh, it's normal. You're in school. It's your adrenals. You're just burnout. It's totally normal. Just get through it. And then I started at the student clinic seeing patients that were similar to me. And one of them had somebody had run an EBV panel and it was positive. And that was the only thing off in her labs. And I was like, okay, because I had said to them, I think I have mono, like test me for mono. And they did test me for mono, but they didn't do the full panel. never looked for reactivation or anything like that. And I was never treated until basically I started, treating myself as I learned, and then found, other physicians that helped with it. And then I did my residency in Atlanta, Georgia at a clinic that pretty much specialized in chronic illness. And it was really helpful in learning because they would run a viral panel on every patient that came in. So I saw all these patients and I would see some people get better, some people not, and started connecting all the dots, and then connecting the dots with myself, with EBV and my own health. And so I guess the blessing in all of this is that I can honestly say that now I feel better than I did, in my 20s or whatnot, even though I've been through a lot. And so I feel like that's just something that I have to share with other people, because there's so many wild chronic illness things going on, and these self-infections that can be so complex. And I'm sure you kind of feel this way too, where if you haven't been through it, it's, the doctors that have been through it can really help guide and see where you're at and what needs to come next. And that's just part of, when you've lived it, it comes differently. So that's kind of why I'm so passionate about it.
Yeah. And what you just said about us going through it, I always thought, and I think I shared this, I might have shared this on another podcast. I always thought that if I showed people that I went through it, or I might be still going through some of it and still kind of in the journey, that it was like a weakness, or that people wouldn't want to see me. But it was actually quite the opposite. When I started telling people more about, hey, I also have these health issues, but I'm working through them. I'm practicing what I preach. I'm doing all the same things as you. I have a naturopath who holds me accountable. I do lab work. I do specialty tests. I'm eating this way. I'm removing these foods that might be inflammatory for me. I'm taking these supplements, and just sharing a bit about the struggle and the day-to-day up and downs has actually made more people want to see me. It was like my fear of not having enough people want to see me, right? It was the opposite. So I think people just would you agree? They just like to feel that their doctor is human, and it creates this human, experience where you feel connected to someone who's been through it, or they understand. Because I don't know about you, these infections can be really isolating for people to have, whether it be Lyme disease or Epstein-Barr, because people don't know enough about this stuff, and their conventional doctors don't, right? So they feel when their practitioner has been there and lived through it, they're like, wow, okay, I feel like I'm in the right place. So have you noticed that in your experience too, that you have, when you're on a patient call and you're like, yeah, I understand, I maybe experienced that myself, or that it actually helps you connect to patients better?
Yeah, absolutely. And I think with what you're saying about, we're all still on a journey, that making sure that we're human, reminding people, that we don't have it all figured out, but also that life happens. You can be doing awesome in your health, and something happens and you're back at square one or figuring it out. And being able to bounce back from life stressors, I think, is one of the biggest things with health. So this idea that you get cured and then the rest of your life you're just living blissfully. I mean, health is such a spectrum. The more that I'm in practice, the more that rarely happens for anybody. There's always life changing, or stress, or you were exposed to this or that, or you get this virus. So being able to really understand your health and how you respond to things, and kind of have core therapies that you do that work for you or whatnot to bounce back is another thing. And sometimes I think it takes time to get to that point, because in the conventional, in this world, it's this idea of you get sick and you take a pill and you're cured and then you're good. And that's not really how it plays out.
Right, that instant gratification. It's like the pill for the ill. And then, it's a tough pill to swallow for people when you say, well, if you've had Lyme or chronic adrenal issues or chronic, viral reactivations, this could be, this you're not discouraging people, but you're telling them realistically, this is now something you have to keep on your radar. So I always say it kind of checks us. Like, I feel like Lyme disease checked me, meaning like when I got diagnosed, I may have been doing a lot more things that I probably shouldn't have done. And now, like, I know, like, okay, because I had that past infection and because of what that did to my body, I now have to make sure I keep up with myself for the rest of my life. And we have, just like you said, if there's a stress, a trauma, a relationship issue, something happened at work, these things can start to come back up. And so I think it's hard for people to understand that with these like viral infections, and we'll talk more about it, or with like past infections like Lyme or COVID, all those things, it may just be this up and down, but not saying that you can't live a good quality of life. It's just there's the realism of, hey, like if this stressor happens or I don't take care of myself, I might start feeling bad again, right? And it's like it's something that we always have to just keep working on. But sometimes people don't want to hear that, just because, like you said, we've been trained in our brain that we do this one thing, we should get better, and the cure is there. So I absolutely agree with that. And would you tell us what actually is the difference between when someone says, I have mono, I have Epstein-Barr, maybe talking a bit more about what it is, like when we would get it acutely versus what a reactivation is. And I know that's a loaded question because there's a lot to talk about on that topic, but maybe starting first with how we get mono or when we might get mono and then what happens after, and then maybe leading into then what, a reactivation may look like, for example.
Yeah. So mono is what most people, I think, are familiar with Epstein-Barr virus, and it's the kissing disease that typically you get in grade school. Sometimes it's more middle school, high school, or even college. I actually have a lot of patients that said the first time they got it was in college, that they think. But typically when you get that, it's the first time that you've been exposed to the virus. And for some people, it can take quite a while to heal from and have that lingering fatigue, but it's more of an acute infection that kind of presents like the flu. So some people will say, well, I never had this. And I'll say, well, you did, but you just might not have been tested, or you might have thought it was the flu. It might have been you may not have even noticed it because it's really mild. And for some people, it does have a low-grade fever, sore throat, swollen lymph node. Sometimes there's a rash. But it's pretty self-limiting usually the first time around. And then if we get it again, well, you don't quote unquote get it again. Actually, once you have it, which 95% of us have been exposed to it. So it's really more rare that you haven't been exposed to it than you have. It stays in our body and in our cells. It doesn't ever go away. We don't ever just kill it out of the body. But if there's a stressor on the body, and that can be any number of things, it can send off a signal that impacts the transcription factors of the virus and take it from an inactive or a latent state to an active lytic state. And when that happens, that's known as a reactivation. And that can present again with the acute symptoms of, the sore throat, the low-grade fever, feeling fatigued, feeling kind of like you have the flu. A lot of times it's more severe because also whatever triggered it, you're dealing with that too. And then, but a lot of times is what we see is you don't really ever come out of it. You might not have the acute symptoms, like you might not have a sore throat or a low-grade fever, but usually the fatigue is the biggest lingering symptom. I would say that and brain fog, although there are a lot of different symptoms that can be associated with it because, again, whatever has been triggering it, your body is also dealing with that. So two people could have EBV reactivation and have different symptoms. One might have, joint pain, one might not. And usually it's not just Epstein-Barr virus when we get into that phase where we're reactivated and having difficulty putting it back into a latent inactive state.
Okay, thank you. That's a great explanation because I feel like I share that explanation. I'm now going to tell everyone to listen to this when we have our appointments because I feel like I share that multiple times a week because every single time we'll do blood work and the Epstein-Barr markers are up. I go through the same, like, well, what's mono? What's Epstein-Barr? And how do I know if it's a reactivation, right? So what I hear you say, so for everyone listening, that mono, first time exposure, more acute type symptoms could look like a flu. People will, right, say to me, I didn't even know I had mono. What do you mean I had mono? Well, we know you have mono because we could see the antibodies in your blood. And like you said, they don't go away. Uh, Not everyone feels sick from them, but you could just feel like a flu. I did want to ask you, because most people have been exposed to the virus in their lifetime, when we're in a reactivation, would you say that people are contagious at that point, or much less contagious because most people have already have that virus? Because I know when you're, a first exposed, you may have, right, you could be contagious. So can you talk a little bit more about the contagious factor? Because in my personal experience, but I'd love to hear your expertise because you do this a lot more than I do. I don't see their partners or people getting it when it's a reactivation so much. I only maybe see that being the case if they maybe present with some of that acute type symptoms. But again, I like more of like they have a sore throat or a fever in the reactivation. Maybe that potentially could be. But again, I'd love to hear your expertise on the contagious factor because people ask all the time about this.
Yeah, I think that's a great question. I would say that my experience has been similar to yours, where their spouse or people that they're living with aren't also having the same problem. I think that when there is an actual reactivation and they're in that acute phase where their early antigen is positive, that they do have a higher viral load. So if there is going to be contagious components, that it could happen then. But my thing is that if they've been living with their family members, the past 10 years or whatever, their family has already been exposed. And most likely, if they haven't been sick previously, unless they also are having some type of external stressor or immune compromisation or change, most likely they're not going to exhibit symptoms. And that's been what I see in practice too, where it's not like somebody comes in for EBV and then they're like, and my whole family has it. Like that just doesn't happen. It's typically they're coming in and everybody else, not saying everybody else has perfect health or whatever, but the other family members aren't exhibiting Epstein-Barr virus signs and symptoms.
Thank you for sharing that, because that's what I've seen, but I wanted to make sure, since you see a lot more patients than me, if you're seeing that as well. And would you say, talking to people about this, seeing social media comments about this, there are some misconceptions about Epstein-Barr virus? Like, are there anything that you could say are myths that you see, or anything that you see kind of trending that's not really holding up in your experience, or anything in that, myth type of, I see this all the time where you're like, oh, you read something as a naturopath and you're like, I wish people would just know this about Epstein-Barr virus.
Yeah, it's funny because when I started sharing my experience, like that's how also this came about, of me specializing in EBV. I was just sharing what I was doing to heal. And at that same time, medical medium was really popular. That's when he released his books and everything. And everybody was like, just do the celery detox cleanse and you'll be fine. And I always tell people, some people might feel a lot better on some of his protocols, because if you go from eating a standard American diet and fast food to having celery juice with breakfast or that alone, you are definitely decreasing oxidative stress and inflammatory levels, and you might feel better. But most of my patients that have, tried medical medium and really have this chronic presentation of reactivation don't get better from just celery juice. So I'm not saying that it's not nutritious or dense in minerals and healthy, but it typically isn't it's not like just drink celery juice and you're cured, in my experience. The second thing is that if you have a positive EBV, that's responsible for all your symptoms. So it's what I see happen a lot is somebody has chronic symptoms and they haven't been listened to, they haven't gotten help, and they don't have any answers. And then their doctor finally runs like something like an EBV panel and it's positive, and then they think that that's the reason for all their symptoms and that is the root cause. And it's not, because Epstein-Barr virus is an opportunistic infection. So if it is active, we have to figure out why. And while I do use antivirals, some patients have a lot of success with high dose IV vitamin C, and I use antiviral herbs and all those things, and I treat the virus. If that's all you do, very rarely will that be enough to give you all of your energy back and get out of reactivation. So this idea that you just need to kill the virus is not going to work.
Yeah. And that's what I see, right? I treat a lot of Lyme and people will say, well, could we start killing? I mean, I don't kill until sometimes I don't even need to kill and they get 80% better. Right. And that's where I feel like as a naturopath, even we differ from some of these functional medicine doctors. And while I think it's beautiful that medical doctors want to learn functional medicine and do more holistic work, I'm seeing a lot of killing protocols. But like you said, it's not, there's usually something underlying it. And it's so ironic you said about thinking Epstein-Barr causes everything, because that exactly what happened to me through I was literally sick since I'm 17 years old, didn't know what was wrong with me. And I just kept getting sicker and sicker. No one knew what was wrong with me. And then eventually I went to naturopathic school. I was like, oh, I learned about Epstein-Barr. And then I did an Epstein-Barr test. And I said to everyone, this is why I'm so sick, is because I have Epstein-Barr. And I remember one naturopath at the time was like, really know if that's, she didn't seem so confident. And I remember feeling annoyed, because I'm like, no, I found it. This is why I'm so sick, and like you get disappointed and you don't know any better at that point because you're searching for what's making you sick. Ended up, I did have Lyme disease, right? I did have mold. I did have gut issues, right? I did have trauma. So there was all of these like root causes that like you said, there was an opportunity for that virus to come out of latency and now become more reactivated. And you also said about the celery juice part, like I agree with you 100%. While I've had some people in the naturopathic world get really angry about people drinking celery juice because there's no like scientific studies on it. And I used to be like, we can't get mad for someone who is telling people to drink celery juice. I mean, it's like, it's a vegetable. We're juicing it. Is it the miracle thing? I did see in my practice that people would come in and be like, hey, I'm pooping better. Hey, my eczema is better. Hey, my acne is better. And then some people would overdo it and drink 4, liters of it a day, and they'd be in horrendous detox reactions and diarrhea. So while I think some people would overdo it, like we would never as naturopaths say, hey, don't drink celery juice. We're just saying that there's usually more to the picture. So thank you for bringing that up. And you also were talking about some testing. So I'd love to talk about how we actually test Epstein-Barr. What I notice happening when people go to LabCorp and their doctors run Epstein-Barr, like, and they give me the panels back, either they just do IgM or LabCorp, unfortunately, I don't know if you have the same experience, in their Epstein-Barr panel, it does not have early antigen. So I usually check 4 totals. So in BioReference, there's actually early antigen in the Epstein-Barr panel, but I always see that one missing. So I'd love to hear more about, how do we test if we have acute mono, like for the first time, right? I think they can do a mono spot, or is it like a throat swab? Like that's like first time. Can you share more about like acute testing? And then how do we check also for blood antibodies in like regular blood work?
Yeah. So for the acute phase, I remember I think I want to say I was 10 or 11. And you can just do a monospot. It's a little finger prick that they run and they check the IgM antibodies. And the IgM are your body's first immune response, or the mother antibodies. But then after that, there are times in reactivations where IgM is positive. According to conventional textbook virology, that doesn't happen, but it does. I see it quite frequently. A lot of times it's associated with things like mold exposure or other immune compromised states. So it does happen. So it is possible. And I do recheck the IgM. And then the viral capsid antigen IgG and the nuclear antigen IgG. So we'll check an antibody response to the outside capsid of the virus and then the internal nuclear piece as well. And those are both IgG. So those are the soldier cells that come in. And these are the antibodies where people say, well, those are positive for the rest of your life because you've had the infection. And that's true. But if you are 10 to 100 times the upper limit of normal and you have symptoms, then I say it's likely that you have a high viral load and that this is in an active lytic state and that we need to treat it to get you feeling better. And then the early antigen is something that I always check. It's typically positive in reactivation between 3 to 6 months. However, I have, again, seen this stay positive for years in some people. But it's also possible that you miss that window and it's negative. And so then some doctors will say, oh, well, see, you don't have it. Your early antigen is negative. But again, if those other IgGs are 100 times the upper limit of normal, then I treat it. And that's how I've been trained, and that's what I've seen work clinically. So that can be confusing. And yes, I've had the same experience with LabCorp where they don't have that in the panel. And so a lot of times patients won't have a full EBV panel, and we have to go back and order that one to get accurate results.
Yes, you've seen the exact same thing. Thank you for sharing all of the antibodies. So there are 4 antibodies that ideally you want to check. And like Dr. Kasey said, even though the IgG ones may be positive because you'll have them for the rest of your life, if they're really high, you have to think of why would they be that high, right? If they were dormant. That's what my mentor used to say to me. Think about it that way. If they were really dormant, why would they be that high? Like, so for example, I've seen people that say over 600, over 750. I've even seen people in the low 200s that, again, if they're not at that 600-700 level, but they're having crushing fatigue, that's where we're a little bit less likely to be doing this textbook like, okay, well, this possibly is what's going on with them. And if someone has IgM, like you said, it could be this, I see the same thing, reactivation. So would you say, although we can get rid of so although the IgG antibodies will stay for life, right? When they're out of a reactivation, you generally see that IgM go away, correct?
Yeah.
Or yeah. Okay. So it will go away. And the other thing I wanted to ask you was, what are your top symptoms you see in patients with Epstein-Barr being one of the main things they're dealing with? And of course, we'll talk about some of the root causes and also other issues that come along with Epstein-Barr. But what would you say are very telltale, I think this person's dealing with the higher viral load or reactivation?
Yeah, I would say the number one thing is fatigue. And it's you're not better after you get a good night's rest. And then post-exertional malaise, which that's a real ICD-10 diagnostic code where you go and you do a workout, maybe you push through your fatigue, and then you get flu-like symptoms for like a week or more afterwards where you just can't handle it. Now, there can be other causes of that too. But I would say that with EBV, there's kind of a specific flavor to that. And then some people do have signs of like tinnitus in their ears or things like that, which that can also be from thyroid and other things. But the EBV, a lot of times I'll see that and I'll I'll test to see if that's going on.
Okay, thank you. And the other thing I wanted to ask you too was, do you see the antibodies making dramatic shifts down when you're treating? Because I don't personally, and again, you have more expertise with this. If the patient's feeling better after I'm treating them and they're like, wow, I'm feeling much better, and their antibody has not gone down at all, let's just say they're at 600 and it didn't go down at all, I take it that they're feeling better because in my experience, their antibodies don't usually go down in large amounts. I've been tracking people for 10 years with this, and it doesn't always correlate in my clinical experience. Their number doesn't always correlate with their symptoms. So, for example, if I treat them and they feel so much better, it's not like the number went from 600 to 200. It might have even gone down to 570, or it might not have even gone down at all. So, have you seen, for people who don't want to get discouraged with, looking at a number, what's your experience with that number actually going down? And do you base it on the patient's symptoms?
Yeah, I do base it on the patient's symptoms. I don't even retest until they're feeling better. And then 3 to 6 months after that, I would say more on the 6-month side now with just the more time that I've been seeing this. And then even then I still go by symptoms. And I just think that the world of virology, that the way that we've, put it in this little box and this is how it behaves and this is the immune function, that we really don't have that fully fleshed out or understood. So definitely going by symptoms is most important.
Okay. And with people who are saying, okay, now I do have Epstein-Barr, I came up with these antibodies, it's explaining some of my stuff. And like you said, they want to go and just start killing it and taking a bunch of stuff to kill it only. What would you say about the root causes of why it could be reactivating in the first place? So what are your most common health conditions or states in which the body feels it has this now opportunity to let the Epstein-Barr virus kind of run rampant at this point?
Yeah, when I started looking at this deeper, I remember going through all these research articles and patient history and cases, and it was like such a basket case. I was like, there's like no two the same. What is going on here? And then it was like, okay, take a step back, zone out. What does all this have in common? All of it increases oxidative stress levels, which is basically our body clearing out toxins. And if we don't have enough antioxidant reserve to clear out the reactive oxygenation species that are created from that process, kind of like when a nail rusts, just over time, it's literally another form of aging. Like that is what ages us. Then when those levels get overwhelming and we don't have enough antioxidants to clear them out, there seems to be a link with transcription factors with the virus that trigger it to replicate. And so that's why a lot of my therapies focus on antioxidant use. And there are antioxidants that, while they're not considered antiviral, that they play against different proteins or transcription factors that the virus turns on and interrupt that signaling. And so oxidative stress can be, emotional stress, trauma. It can be toxins like glyphosate. It can be other infections like Lyme. Mold is a huge, huge source of oxidative stress. So then it becomes, me and the patient really working through what else is going on in this picture and treating that, and then soaking in antioxidants, still using antivirals, because the real kicker is that, well, EBV itself, when it turns on, is creating oxidative stress. So then you have this snowball effect, and that's why EBV is linked to autoimmune conditions and cancers and all this scary stuff. So we have to combat that while we're also treating the virus. And it's kind of like a snowball. You just have to work through it all together. And I think that's why a lot of people don't get better, is because the conventional medicine is not wired to address health in a holistic way like that. And then even I see, people that have worked with functional medicine providers or whatnot, sometimes still it's this linear thinking of we just treat this and they'll get better. And treating things like this is not linear at all, as I know that you know very well.
Yeah, it is absolutely not. There's so many complexities to it because how many people are you seeing that it's like there's mold, then there's Lyme, then that reactivated their dormant Lyme. Now they have Epstein-Barr, and now they have this and that. So in my experience, and I know it seems boring to the patient because it's not fancy, but that those foundations, and I preach about them to not ad nauseum, that those foundations will help just even in and of itself, like diet and lifestyle, nutrition and lifestyle will help just reduce oxidative stress in and of itself, right? So going back to those basics and what you just said about autoimmunity, and I actually learned from you that the nuclear antigen you had shared, I think, with me, that one is a bit more linked to autoimmunity. Is that, do I remember that correctly?
That's how it looks in the research. Yeah.
Okay. So that one's a bit more linked. Have you seen in your practice patients who you feel their Epstein-Barr did drive that autoimmune process, or is it hard to say because they also had so many other things? Like how we say there's, this research about EBV and autoimmunity. Just curious your thoughts on that.
Yeah, it's that chicken or the egg question. I think that once EBV is active, so it might not be that EBV was the start. It might be stress or poor diet or mold exposure, whatever. But once EBV is turned on, it is like pouring gasoline on a fire, and it is dangerous because we're pushing on these pathways that lead to autoimmune conditions or cancer. There's a really specific link that came out, I want to say it's been 2 years, maybe it's been 3, with multiple sclerosis and EBV. And so now anytime I have a multiple sclerosis patients, we screen for EBV, and I've never not found it. But again, it doesn't mean that's the only thing, but I think it definitely does drive things forward on a negative path.
Yeah, I actually saw that too a lot about the MS. It's kind of like when you have Lyme, you have to check for other things, or for example, when someone gets a diagnosis of Parkinson's or some other thing, or, they have rheumatoid arthritis, you're always checking, right? Is there Lyme? The same thing with like Epstein-Barr virus. And can you share with everyone what you would think would be the biggest bang for your buck in terms of antioxidants? Would it be like looking right at your diet? Is it like, what would you would say are your most foundational ways that people can take away with to increase their antioxidants or to just decrease oxidative stress?
Yeah, I mean, you could take all the antioxidants in the world, but if you're not decreasing that oxidative stress, then there's a problem. So definitely the easiest way is what we put in our mouth, right? And then our nervous system and emotional regulation. Those two are things that we have to master. And then from like a supplement perspective, glutathione and curcumin have the most data on pathways like the NF-kappa B pathway that's associated with a lot of inflammatory conditions, and curcumin combats that very well. And then from there, it kind of depends on what's going on. Like if it's an acute presentation, I really like using vitamin C. We do have data on high dose IV vitamin C. High dose is 25 grams or above. I see a lot of people going and getting 10-gram IV vitamin C, and it's like, that's not, it's probably still beneficial, but it's not doing what you think it's doing. But we do have data showing that lower antibodies. So if they're in an acute flare-up, vitamin C, and you can do oral at-home vitamin C as well. But those are just, like basic antioxidants. NAC actually has some good research with it too. So, if somebody has EBV and then they have a sinus infection or flu, then I use that because it's also helping with their respiratory tract. So that's what's great about seeing a naturopathic doctor, and they'll pick the antioxidant to match where you are most vulnerable to. So it's always, like I tell people, two people can have EBV and their symptoms are totally different. So their plans are going to be totally different. So there isn't this just one size fits all protocol. I don't have a magic,
Yeah, exactly. And people think we're being, like we're trying to be vague or not answer the question when they're like, well, what should I do? It just really depends. Like as a naturopath, it really depends on why you had it in the first place. And then, like you said, we're targeting treatment for that specifically. And I'd love to talk more about stress and emotional trauma and that relation to Epstein-Barr and how the nervous system is hugely, I would say, one of a huge fire to create this Epstein-Barr reactivation.
Yeah, I would say that in some of my patients that are doing everything but aren't getting better, it's because they haven't dealt with past trauma, or they're in kind of this, I guess I would say more of a type A state where they're just going and burning the candle at both ends, even when they're fatigued. I typically always check adrenal function with EBV because I don't want to miss somebody having low adrenals or even Addison's disease. And that's something that happens is we chalk the fatigue up to EBV and then we miss actual low cortisol. And so without a nervous system that's in check, you're not going to be using your immune system properly, because when you are in a rest and digest state, your immune system works optimally and your body heals. When you're in a fight or flight state, you're literally getting ready to run from a grizzly bear. And that can be a text from work that's stressful or whatever. It doesn't have to be this monumental stressor. But I've seen patients where it's like, they just say, well, my life is just stressful right now. And it's like, well, until you can, get your nervous system regulated, which means, doesn't mean there's not stress. It means that the stress comes and you don't emotionally react, and you keep your breath where you are activating your body and telling yourself that you are safe and your immune system stays stable. So it doesn't mean that the stress stops, because I don't think I need to tell anybody that the stress isn't going to stop in 2025.
Humble, guys. This is there.
Yeah.
It's there to stay.
So we have to replicate that.
The resiliency, right?
Yeah.
Just having the resiliency. Someone said to me the other day that, how am I not going to have stress? I just have a baby. And I said, well, we're not stopping the stress. We just have to help you adapt to it better. Just like you said, we have to be able to, right? And that's where looking at the adrenals, I'm so happy you brought that up, because we might just think it's EBV, but even just working on the adrenals, right? And if someone has really low or really high cortisol, that's going to affect them significantly. But I think people think that if they have stress, do you know Dr. Donnie Wilson? I don't know if you know her.
I know her through online.
Yeah, she was, I love her. I actually, I did some clinical hours with her in medical school, and that's how I met her. And she would talk on and on with patients, which I loved, about stress, and she wrote books on stress and burnout. And and she basically tries to bring home this point that we can't have it go away, right? We can figure out how to, like you said, feel safer in your body and not feel like everything is a catastrophe, and be able to adapt more to that stress and create that resiliency there. So that is one of the main things that I do when patients have chronic illnesses like Lyme or Epstein-Barr. I'll do a Dutch where it will do their hormones and also their cortisol ×4. Do you like those type of tests? Is that what you do for adrenal type testing as well?
Yeah, I usually start with morning blood cortisol. And then if that is, not looking good, then I'll do the salivary cortisol, depending on insurance or what the patient has. But yeah, that's a good one.
Yeah. So yeah, I definitely agree that we could do a blood test at first. We could definitely do a blood test at first to just check that morning one. The only thing I notice with my patients is they always like they always miss the window and they're always being sent home, because I think you have to do that morning one before, what is it?
I think it's before 8.
8?
Maybe?
Okay. 8.
Uh,
Okay.
yeah, somewhere there. I think
You
between
see,
8 and 9.
yeah. Okay. And do you see the total cortisol in blood being even that helpful?
I do. Yeah.
Okay, so you'll see that being a bit high. Okay, so you'll basically, your first is, let me do an AM cortisol. And if someone is having a low or even a high, then you'll say, okay, if they could financially, let's just do some of these specialty tests. Okay, that makes sense. And then I also wanted to just ask you, are there any other things that people say, hey, I think this is Epstein-Barr causing my fatigue, but you're seeing it could be other things that are not something on their radar? Would you say it is just like the mold type pictures or the nervous system type patients that need to get workers, or anything else that's maybe a bit off that you're not, that people are not talking about as much, that could be another cause of fatigue? Or would you say it's all the ones we talked about so far?
The ones we've talked about have been the most common. Since COVID, there's also been an increase in just oxidative stress in general and how that person is processing spike proteins. So there's been a lot of reactivations post-COVID from the infection or from the vaccine. And there's, that was kind of in the research about 2 years ago. So not new now, but I would say I'm still seeing that trend.
Yeah, thank you. I actually forgot about COVID. I can't even believe that was one of the most important things that are reactivating Epstein-Barr, and like you don't even want to hear about COVID anymore. You're like, get it out of your brain. But thank you for bringing up COVID. So you're seeing patients who either they get the actual infection and or they're vaccinated and then having, Epstein-Barr reactivations. And now they're feeling that what you call long haulers. Would you say long haulers is also because they're experiencing Epstein-Barr reactivations, and even I'm seeing some Lyme infections coming out of dormancy?
Oh, absolutely. It's I think whatever was already brewing is more vulnerable. So definitely Lyme. And I think kind of like with what we've been talking about with EBV, that 2 people that have long COVID could have totally different symptoms and be dealing with different things.
This has been so awesome talking about this with you, because I think so many people can benefit from hearing this, especially who are not feeling well, who think that Epstein-Barr may be their one root cause, where it can be a compilation of things. So do you have any last bits of information you want everyone to know about Epstein-Barr or chronic reactivations, or a takeaway for everyone who's not feeling their best?
I would just like to remind everybody that their body is made to heal and that it's designed to overcome these opportunistic infections. I know everything we've talked about is overwhelming and it feels like, where do you go? There's not a clear path, but that you will find what your body needs and that it will be unique to you and that your body is designed to overcome this.
Thank you, and for giving people hope. So if you want to learn more information about Dr. Kasey, you can go to her Instagram, Dr. Kasey Holland, and it's Kasey, and her website is drkaseyholland.com. You can also grab her newsletter by adding your email to her email list. And I hope you guys feel amazing now that you learned more about Epstein-Barr and you have a little bit more of a roadmap. So we do encourage you to get some naturopathic type help so that we can figure out what is the root cause for you. Thanks so much. See you soon.
Thanks so much for listening to Modern Day Naturopath Podcast with Dr. Sue.